Hey guys, just a reminder, this is not official medical advice. For such, please seek an appointment with a licensed medical provider.
Hi, this is Dr. Tom Rogers coming to you today with the podcast called The Common Sense MD. We're going to talk about something that's not so common, but very fascinating, very important in today's world. Again, I have Dr. Jamal Maatouk with me today, oncologist that's been practicing in our area for many, many years. We had a discussion last week on the general nature of a cancer patient, which I don't even like to say a cancer patient because it's just a human being. I don't like to label people as a cancer patient or a diabetic. And you talked about the mind, body, spirit a lot last week. So if you didn't see that podcast, please go back and listen to that because it's a good lead in for what we're going to talk about today. We're going to get more specific about the different treatments of cancer and how you approach them, because I love your approach on getting to know the person, because there's no two individuals alike. There's no two cancers that are alike. There's no cookbook formula. There are guidelines. But Dr. Maatouk, what I want to get into today with you is a little bit about which cancers that you would have cut out surgery, which ones are amenable to radiation, chemotherapy, maybe even the new immunotherapy. So in general, give me a little idea about how you make a decision about this.
So the treatment for cancer involve all modalities that you talked about. So it includes surgery, chemo, radiation sometime, immunotherapy sometime, targeted therapy sometime. Targeted therapy means we target the mutation in the cancer. So we have a lot of these treatments. That's why cancer patients now live longer, because we have more treatment. Now, as far as who to give radiation, who to give chemo, it depends on the type of cancer and on the stage of the cancer. And we all, practicing oncologists, we follow guidelines, NCCN guidelines. We always, see which patient, which stage, and then we recommend treatment. Now, the trick happens when we have 4 first-line category recommendation. And then this is when the doctor has to decide which one is the best for that patient versus the other patient. Maybe the side effect will not fit what the patient has. Maybe he's on medication that interact. Maybe he will not tolerate that medication. So then the art of medicine starts.
The art of medicine. Like you told me, no two cancers are alike, and that you have to get to know that patient and their wishes. Some people that I know, and that we've talked about them, prefer you do nothing. As far as any chemo, surgery, radiation, they don't want anything. And so then we have to also, we can't just say, okay, well then don't come in. No, we have to, as doctors, help them in some way. And there are ways to help this patient by teaching other functional ways to look at things.
So there is, no person is like the other. And none of us think the same way. So patients are humans. So some patients come and they want us to help them with the medication, the chemotherapy, the radiation, the immunotherapy, the targeted therapy. Some patients want us to help them how to do their job to heal themselves, because there's a lot of awakening now and people know how powerful they are as a human being. And then the question I ask a lot of my patients, so I know how they think, I ask them, do they take any supplement? Do they read some books? Do they exercise? What do they expect? Those questions and the way they answer it help me know what patient or which patient wants what or needs what. In this way, this open discussion helps me guide them which way to go. So there's no two patients that are treated the same way. And that's what I love about being a doctor, is being able to help people the way they want help. So if they want chemotherapy, I have plenty. If they want immunotherapy, targeted therapy, I have plenty. But if they want to do their own healing, I can help them do it too. And that's what I love. I want to help everyone the way they need to and the way they want to, or the way they're ready to, because we are all in different stages in our journey. Whether doctors, whether patients, whether children, we are all in different ways in our journey. To me, there's no right and wrong. There is only love. I love all the same way. If they want this or that, I still love them the same way. I'll monitor them the same way. I'll help them the same way. I'll stay with them the same way till the end.
There's no right or wrong. There's only love. I really like the way you put that. That's wonderful. You're not going to hear that from many doctors. You know, with cancer, it's almost like you can't be a robot or use AI to be an effective oncologist or any kind of doctor, in my opinion. There's so much more into it than just numbers or codes or something like that. Let me ask you, for the people that are not familiar with it, what the difference is between immunotherapy and targeted therapy.
So immunotherapy is a drug we use that I'm going to use it as a cartoon description. So immunotherapy helps the immune system be wild and strong to a point it sees the cancer. So our immune cell will be able to see the cancer, kill it, and get rid of it. So by itself, immunotherapy does not kill the cancer like cytotoxic chemotherapy. It makes our body, our cells, sees the cancer, click on it, and then get rid of it. Targeted therapy is like a target. Let's say patient has ALK mutation, EGFR mutation, BRCA mutation. We target those mutations, like we send a drug that stick on those receptors and then paralyze the cancer cell or make it not able to multiply.
Is it like CAR T therapy? Tell me about that a little bit.
So CAR T therapy is we take the blood of the patient and then we treat it. We teach it how to heal, and then we inject it back to the blood or body of the person, and then the person start the healing.
So you think these advanced ways of treating cancer are way better than the standard chemotherapy that most people have heard about, chemo or radiation?
A lot of time it's less cytotoxic.
Less side effects for sure.
Mm-hmm. There is side effect, but it's less cytotoxic, and definitely if you target the cancer directly, it's more helpful than blindly shooting with big guns like the chemotherapy.
So you have told me in the past that you like using lower dose chemotherapy combined with other measures. Mm-hmm. Is that an accurate description of what you do?
Because let's say I have an elderly person who is already sick and her body is already sick or his body is already sick. I cannot give them the full dose chemotherapy all the time. So if I do 25% dose reduction, for example, and they handle it well, why not? If they get where I want them to be with a little less, which decreases side effect, why not?
I agree 100%. Go low and start slow, go low is the way I always do any medicine.
And again, every person is different, like some people can handle this, some people cannot.
Do you think that you said earlier that we're keeping people alive longer because of these new therapies? Mm-hmm. Do you think that some of the things that they did in the past with chemotherapy actually didn't make the quality of life any better? It may have made it worse, and some of them made a bad decision to blast somebody out with chemo?
In the past, we didn't have anything other than chemo.
Yeah.
And again, a lot of us human, we fear death. And whatever is available, they're agreeable to take it. now what's happening now, and that's why I said there's a lot of awakening, patients are questioning doctors. They're reading, they're opening up to more options, and they're asking, why do I need to get that? Can I do it without that? What other options I have? What happens if I don't take the chemo? And some of them say, leave me alone. I want my quality of life.
Yep, yep. What do you think about second opinions? When should somebody seek a second opinion?
I love it.
Oh, good. Me too. Me too.
I love it for two reasons. One, I always say two brain better than one. So if I talk with another doctor, maybe I highlight on the issue from the right, they highlight on the issue from the left. Plus, we are all follow guidelines. So let's say the patient is questioning my decision of this choice of chemo or this way of treating. We all follow guidelines. So they're gonna go to a bigger university, bigger place, and they're gonna hear what they already heard. They're gonna trust me more. So I encourage patients for second opinion, because if they want the treatment by the guidelines, that's what I'm gonna be doing. So I'm not concerned a bit. And if I don't know what to do, there's a lot of situations where really medicine is challenging. As I said, patients are not alike. Cases are not alike. And sometimes it's challenging and I need help. So I'm the one who I say, I really want you to go to an expert. So I'm human. So, and I don't claim to know everything. I only claim that I would love every patient, and that's my only thing I go by. I'm not the smartest, and if I need help, I ask it.
Well, I think you're one of the smartest I've talked to, and you're also one of the most empathetic physicians I've talked to. So,
thank you.
The way I'm like you. If somebody wants a second opinion, number one, that's their right. And number two, it never hurts my feelings. Some doctors will get upset, but I'm all for it. It should not hurt a doctor's feeling. It's your right to get a second opinion.
Or third opinion. I always say when I'm in the clinic serving a patient, that's how I look at it. It's not about me. It's about them.
That's right.
It's not my ego. They're not here to please me. I am here to serve them.
I agree 100%. They come to us. You know, we should consider it an honor.
Yes, I want to serve them. I mean, that's what makes me happy, is help people feel better.
Let me ask you another. This leads into something else that I deal with almost on a daily basis with my cancer patients. And again, I'm not an oncologist. I don't treat a ton of cancer, but people know that I'm an integrative medical doctor who's studied it and board certified in it, which really means looking at root causes and other ways of dealing with things. So I'm kind of a blend between traditional and alternative. So I know the traditional medications, and I know a lot about natural
and we need both
things. And I agree, we need both. But the thing I want to talk about a little bit is when I do get a cancer patient, I always, because I do use a lot of alternative or adjunctive type treatments like ivermectin, fenbendazole, IV vitamin C, a lot of things like that, curcumin and turmeric, TUDCA maybe, melatonin, a lot of things that I will treat the cancer patients adjunctively with. And a lot of times they may go back to their oncologist and they tell them, well, Dr. Rogers is treating me with fenbendazole. And automatically either they kind of know whether they like it or not. They may throw them out of their practice. So I tell that patient, well, because they asked me, should I tell my oncologist that I'm doing this? And I go, yes, I think you need to be honest and tell your oncologist what you're doing.
Because they need to check interaction.
Exactly right. But a lot of times if they get a feeling that their oncologist is not on board with any of this, that they may need to talk to a different oncologist. What are your feelings about some of these adjunctive type treatments that we do?
Well, let's say I'm going to go to the extreme. Let's say they don't work. If you believe it will work, then it will work. It's like the placebo.
Mm-hmm. Mm-hmm.
So there's a lot of data out there about all the drug you mentioned. And it just takes us an effort to go and look about the trial that they were done by NCI and NIH starting in 2020. But not to go deep in those drugs, we go back to the patient choice. What do they want?
Yeah.
How they want to address their treatment. And my job is to support them, knowing if it's safe or not. Check it out. Does it have interaction? What are the side effects? It's their choice. And if it comes to me, as we talked earlier, I want to teach people really that even without any drugs, they can heal. Even without any chemo, no surgery, no medication, they can heal. It sounds crazy, it sounds woo-woo, but it's not. We are made to heal ourselves. Since we are in the womb, our cells knew what to do. Our stem cells, we started from one cell. One stem cell made the nose, eyes, liver, kidney, because each cell has its intelligence. We never lost this intelligence. We suppressed it. And if we teach people that they are powerful and able to heal themselves, that's what I would do every day. That's what I live for. That's my goal, is to teach people this, that they are powerful enough to heal themselves. And it's not woo-hoo. They can do it. They just have to believe it. And I don't want to go in religion, but Jesus taught us this. That's what he said when he said, the smallest among you can do everything I have done and greater things. What does it mean? When he said you can move mountain with a grain of faith, what does he mean? What does Yogananda said? What does other religious figures said? That's what they all taught. No matter how we frame it, those big gurus, those big teachers, they did it and they came to show us the way. We just have to believe. I cannot say I believe in this man or that man, or I belong to this religion, and not really believe. So to me, my goal is to teach them to heal themselves. Soul, spirit, and mind. Definitely they need to eat healthy because they need to respect their body. We're all one. I have to respect the body. I cruise through it in life. So I have to honor myself, know who I am as a soul, and learn or remember, because we all have it. We're born with it. We have to remember who we are, children of God, and that we have this innate power to heal ourselves. Still, they want to do, I don't know, if they tell me coffee heals, go for it. If they tell me chocolate heals, go for it, I'll take it, It's just how they want to do their healing. I'll support them, provided I use my medical knowledge to know if this is healthy or not, if this interact with what I'm doing or not, if it's going to cause trouble or not. And then it's up to their body, their mind, to do the job.
I agree with you 100%, and thank you for having the courage to talk like this when it's so put down and put away. But certainly we are human beings, we're faithful creatures, and we learn. And different cultures think different things. Certainly we've seen miracles. I know if you've been in medicine as long as we have, I've seen miracles happen a lot. And we can't explain them. We just can't explain them. But I do think it has a lot to do with God, your faith, and your outlook. So I think a lot of healing is done from within your own self. You just
100%. Healing never happens with a drug. Healing happens from inside out.
Exactly right. And you just have to search and know yourself, and take advantage of all the different modalities like that we have that will help, like the immunotherapy, the CAR T therapy maybe. And thank God we have people like you that study this and that know it and have the experience. There's nothing that beats experience, is there? There's no book. When you come out of medical school, you're not really a doctor. You don't deserve that title because you don't have the experience yet.
No, and you learn every day. I read every day. In the morning, the first thing I do, I open my up-to-date, my NCCN. I keep myself updated. I read the data I look for. I research. And that's how I do my day. I learn every day. I learn the medical part, and I help myself grow and learn my spiritual part, because I combine both every day.
Something called hope is very big with healing. But thank you so much for sharing that with us. Now you know the difference between CAR T, immunotherapy, targeted cell therapy, not just chemo and radiation. There's plenty of ways to treat cancer. And so if you do get a diagnosis of cancer, then don't fear it. You have to just almost embrace it and embrace yourself and realize that healing is possible no matter what it is. So I'm very, very thankful that you're here opening up, and you're an oncologist that actually, you really have faith that the other things can work besides what we've read in a book or has been taught to us by...
Science is evolving.
Science is evolving. And what is science? That's been the question of the last 5 years. What is science? So I hope we're having a scientific discussion. But it also involves being humans and making decisions and having hope and faith. So I hope you got a lot from this podcast. We're going to do more of these, and I thank God there is somebody like you that's a board-certified oncologist that can help us with these questions and help us get answers. Thank you so much, Dr. Maatouk. We'll see you guys next week.